Hello, dear ANA community. Do you know what is meant by golden circle? Do you know how to apply this particular principle of golden circle in Roga Nidana learning, which can be applied to learn any of the subject? So, in terms of the Ayurveda or in any of the other speciality, this is the topic of discussion in this particular video. Dear community members, press the like button and press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Don't forget to spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. When you think about the principles of Roga Nidana learning, so which can be applied in terms of the golden circle, which is being said by Simon Sinek, a renowned author who wrote the book Start With Why. So here he says that golden circle, which is having the three different circles, innermost circle is related with the why, and the outer circle how, and outermost circle is related with what. When you think about the application aspect, so the word why, so that is we are going to learn, that is we are going to work with the mindset of the learning as such, whereas the how and what, they are mainly related with working on the skill set. Whenever if you want to learn any of the subject, we have to work on the mindset up to 80%. 80% mindset we have to work on that, and later we have to work on 20% of the skill set as such, which will be helping us in learning deep in any of the subject as such. This is equally true in terms of the learning the subject of Roga Nidana. So that means, first of all, we have to know why we are going to learn this particular subject, which is considered to be working on the mindset itself, which may require 80% of your efforts on this particular part, so which will be helpful in ease of the developing this 20% of skill set on how and what of the subject of Roga Nidana as such. When you think about the golden circle application in terms of the subject of Roga Nidana and Vikriti Vijnana, it is being said that, so that is the why, so that is mainly indicative of the reason for learning about the Roga Nidana. What are the reasons why you are going to learn that particular subject as such? When you think about the how, which is mainly related with the process of learning, how we are going to learn that particular part. And third one, what as such, so that is actually dealing with the steps of learning Roga Nidana as such. Now, when you think about this, we are going to learn each of these with few examples as such. When you think about the why of golden circle of Simon Sinek in the learning the Roga Nidana and Vikriti Vijnana, it is being said that Sankshepatāh kriya yogo nidana parivarjanam. So that means whenever if you want to what do you say, that plan any kind of the treatment or management as such, first of all we have to identify the actual nidana and we have to avoid the nidana as such. The Dalana says nidananam doshakaraka hetunam rogakaraka hetunam cha sarvato varjanam. Nidana, so that is the causative factor which are considered to be doshakaraka. So that means which are responsible for the increase of the abnormal dosha in the body, plus rogakaraka hetu. which are considered to be responsible for the manifestation of the disease. If you are avoiding it altogether, 100%, so that is considered to be main line of treatment as such. So that means almost 50% of your effort is eased by knowing about the actual Nidana and avoiding that particular Nidana. For this, it is identifying the Nidana as such that is very difficult part. Because when you look into the textbooks as such, more than 3000 plus Nidana that may be available in Sushruta Samhita itself. For that reason, so you have to be know about the following steps as such. We have to have the proper interaction with the patient. So that means how we are going to get the information. Some of the occasions, the patients are very reluctant to give the information regarding their ill health, particularly when they are suffering from any kind of the sexual illnesses as such, or any kind of if they are having any kind of the problems related with their sexual behaviors, or otherwise if the person is having any kind of the diseases, something related to the renal system or the perianal diseases, etc., etc. In that particular situation, so we have to be very careful while getting the information properly. If you are giving the information or if you are interacting with the patient with confidence, then only the patients are in a position, they will be getting the confidence in giving the adequate information to you. The next thing as such, that is we have to identify the symptoms as such. So that is identifying the symptoms, whether the person is suffering from any kind of the respiratory disease or whether the person is suffering from any kind of the cardiovascular disease. For that, the patient interaction and identifying the symptoms itself is the main motto of this learning of this particular subject. Identifying the lakshana in relation to the Raktabaha Srotovikara. Identifying the lakshana in relation to the affliction of a Pranavaha Srotovikara. Identifying the ama in the body. Identifying the actual sadhya sadhyata. Identifying the arishta lakshana. Identifying the upadrava. Identifying the, what do you say, that the Pururupa, etc. So that requires the proper interaction itself. So the next aspect, that is the localization of the lesion. Which particular part of the body is having the discomfort? Whether is it the amashaya, or whether is it the pakvashaya, or whether is it the janusandhi, or whether is it the shiras, or whether is it the bahu, or whether is it the hasta or pada. So like that, localization of the lesion has to be done. For this, the knowledge of Roga Nidana and Vikriti Vijnana will be helpful. So as per the current interaction, as per the current science, localization of lesion, whether the lesion is present in the mouth, or whether is it present in the esophagus, or whether is it present in the small intestine, or whether is it present in the large intestine. In terms of the neurological lesion, whether is it present in the brain, whether is it present in the forebrain, midbrain, or hindbrain, or whether the lesion is present in the spinal cord, or whether the lesion is present in the spinal nerves, or whether the lesions are present in the autonomic nervous system. So like that, localization of the lesion that can be done if you are knowing this particular subject very well. And how to identify this particular nidana leading to this particular disease itself in the body. So in the sense, how the consumption of laghu ahara will be responsible for the affliction of pakvashaya gata vikara. So that is, this can be identified by proper learning the subject of Roga Nidana. So one thing, that is Nidana identification, that is the main purpose. Second thing, that is Hetu Sankara, identifying the Hetu Sankara. In the sense, one particular Nidana may be responsible for the multiple disease manifestation. One particular Nidana will be considered to be responsible for the one disease manifestation. Multiple Nidanas They are responsible for one nidana, one disease manifestation. Multiple nidana are responsible for the multiple disease manifestation. For this, you have to know about the significance of hetu or nidana, which were being done earlier in this particular channel. You will be getting the understanding of the word concept of hetu sankara there. That means if your why is very clear, then your how that will be clear based on that. So for that reason, it is nothing but the process of learning. In the sense, whenever if you think about it, you have to get organized in learning. That means you have to carry a planner always with you. Whenever if you think about the planner, you should be clear of distractions. Nowadays, distractions are plenty. Information overload is available in present day social media. So that means millions of informations are uploaded every day from different social media platforms. So that means it is very difficult for identifying your right information as such. For that reason, you have to be very clear of what you really want as such. So that is when your why is very clear, then if you are working on the that is the distraction clearance, then the learning will be faster. If you are getting any of the doubts as such, then you have to ask questions. Follow the Pomodoro technique. Pomodoro technique in the sense 25-5 method. So that means 25 minutes of learning and 5 minutes of small break. Then again 25 minutes of learning and 5 minutes of break. In that way, you can do that. So this is considered to be one of the method of what is that learning the subject as such. So here let us take the example of a planner as such. What you can do the planning as such. So here, first of all, 10 different topics we are going to decide. And among that, the first one, what is the concept of dosha? What is being told in the Ayurveda texts in terms of the dosha as such? Doshayanti iti doshaha, doshayanti manah shariram chiti doshaha, prakrityarambakatve sati swatantrena dushtikartritvam doshatvam, etc. So these are the different meanings for the dosha as such. How this can be learned based on the present day as such. In terms of that, there are basically three sharirika dosha are there. What do you mean by vata dosha? What is its understanding? How to understand vata dosha physiologically? How to understand vata dosha pathologically? What is its application in current era? And what are the reasons for the vitiation of abnormal vata dosha? Is it vyayama, or is it apatarpana, or is it prapatana, or is it bhanga, dhatukshaya, vegadharana, ratri jagarana, etc. So they are considered to be the reasons. How to identify the reason, exact reason for the vitiation of vata dosha? Which particular guna is being increased in the body? Whether by doing the apatarpana, is it the ruksha guna is increased, or is it the lagu guna is increased, or is it the shita guna is increased? That has to be analyzed properly. And how we are going to identify the abnormal vata dosha in the body? What particular lakshanas are being observed? Is it the emaciation, or is it the constipation, or is it the bloating sensation in the abdomen, or is it the vomiting as such, feculent vomiting, etc. These are the possible lakshana we may observe that. And how to link the information of vata to other subjects. So that means information of the vata in terms of the dravya guna, information of vata in terms of Rashastra Vaishajya Kalpana Vijnana, and aligning the linking the information of vata dosha in terms of the Samhita Siddhanta, etc. So that is we can able to, if you are going to do this, then learning will be very easy. Then, how to link Vata in terms of the rasa? Shmam bhog nikshmam bhuteja khavai vajnani lagonirai. So that is the rasa and Mahabhuta. When you think about the Vata dosha, in terms of the rasa, it is being mentioned Tatradya Martam Ghranti. So that means the Madhura, Amla, and Lavana rasa, they are considered to be responsible for this, the remission of the symptoms of Vata Prakopa, whereas Katu Tikta Kashaya, they are responsible for the increase of Vata dosha as such. Guna. Tatra Rukshu Lagohu Shita Khara Sukshmaschalo Vanila. These are the guna, they are responsible for the increase of the Vata dosha in the body. Virya, Shita Virya, Dravya are responsible for the abnormal vitiation of Vata dosha. Vipaka, Katu Vipaka, as such, that will be responsible for the abnormal increase of Vata dosha. And regarding linking the Vata dosha in terms of the Mahabhuta, so that is the Vayu and Akasha Mahabhuta. They are responsible for the abnormal increase of Vata dosha in the body. How to link the concept of Vata vitiation in terms of the Chikitsa? Vatasyopakrama sneha sveda samshodhanam mrudu, etc. are being told by Vagbhata. So, to apply this in terms of the Vata dosha vitiation, if you are able to link these, then learning this particular subject with deep understanding is very easy. This, by knowing about this, then if you know about the what of the golden circle, then here what we can say, the working on the skill set as such. So that is step by step learning of the particular Roga Nidana. So that means the first and foremost thing, proper communication with the patient itself. If you are able to communicate with the patient properly, initially a student as such, whenever if they visit the hospital, they are having the some kind of the anxiety, some kind of the, what do you say, that the hindrance in having the interaction with the patients, whether they are properly talking with them or not, they will be having the doubt. If they start interaction, initially that may go 2 hours, sometimes it may go 3 hours, 4 hours as such. In case of the difficult cases, the students are having the interaction with the patient up to even up to 8 hours also. If you are having that particular type of the depth of this interaction, then identifying the lakshana in the patients by the clinician is easy, by the student is easy. How to apply Shakrit Graha or constipation in terms of the Vata dosha vitiation. How that is responsible for the other Vata dosha dominant diseases as such in the patients. So that can be learned as such. And regarding the Bahya Srotas and its application. So that is, we are knowing Bahya Srotas 9 are present in males and 12 are present in females. So whenever if a person is having the exposure to Nidana, that has to enter through any of these 9 or 12 orifices itself, which are responsible for the atypical clinical manifestation related to that particular Bahya Srotas. Whenever any kind of the pathogens are entering through the nose, the initial lakshana that may be observed will not be in the mouth as such. Initial lakshana which may be considered to be will not be related to anus as such. So this lakshana will be related to nose only when he is having any kind of exposure to the body via nose. In this way, so you have to identify which particular Bahya Srotas is being afflicted. Along with that, is there any possibility of any kind of the internal causes which are responsible for disease manifestation? That has to be known. For example, if the person is doing excess amount of the Vyayama, so that will be responsible for the, what do you say, that mobilization of fat which is being stored in the subcutaneous tissues, which are entering into the circulation, thereby which may getting entangled in the either in the coronary arteries or in the cerebral arteries or in the peripheral arteries in the lower limbs, etc. So those are the internal causes which may be responsible for the manifestation of the lakshana in the patients as such. After knowing about that, we have to know how to do the examination properly. How we are going to decide the person is suffering from this particular systemic disease itself, which is considered to be there are two varieties: general examination and systemic examination. General examination in the sense we are going to interact or we are going to do the examination of the patient before going to the systemic examination. So which will be helpful in identifying the probable organ system afflicted in the patients that can be very well identified. Then making the diagnosis of the disease properly. Which particular the disease a person is suffering from, whether the person is suffering from any kind of the respiratory disease, or whether the person is suffering from alimentary canal disease, or whether the person is suffering from musculoskeletal disease, or whether the person is suffering from any kind of the pranavaha srotovikara, or whether the person is suffering from the rasavaha srotovikara, or whether the person is suffering from the purishavaha srotovikara, whether the person is suffering from svedavaha srotovikara, whether the person is suffering from any kind of the bahya srotas involvement as such. So in this way, the diagnosis of the disease can be done as such. Then differential diagnosis. So that means we are going to identify the possible list of the diseases which may be presented with the similar clinical presentation. Then based on the nature or course of the symptoms or symptom complexes, we are going to rule out the each and every diseases. So that is what is considered to be differential diagnosis, which is being mentioned in Ayurveda the present day as Sapeksha Nidana and Vyavachedaka Nidana. After that, we are going to learn about the laboratory and imaging interpretation. What is considered to be the hematological interpretations, how to understand biochemical investigations, how to understand serological investigations, what is the utility of the urological investigations, how to interpret histopathological investigations. What do you mean by the X-ray or ECG or the MRI, CT scan, etc. Interpretation, if you are learning, if you are knowing about it, then applying the sadhya sadhyata of the disease in the individuals, if you are doing that, how we are going to say the person is suffering from sukha sadhya vikara, how he is how you are going to say he is suffering from the pratyakhya vikara, and by doing all these, if you are interpreting, if you are doing the proper communication with the patient regarding this in terms of their presenting complaint, in terms of their the srota supplication, in terms of their physical examination findings, in terms of the laboratory and imaging interpretations, and at last, if the person is considered to be visiting again, then doing the communication properly, doing the necessary examination, and communicating the outcomes. These are considered to be the proper step-by-step learning, or what we can say the part of the golden circle in Roga Nidana. To sum up, whenever if you are learning any of the subject as such, be clear what is your why. Be clear regarding the your mindset as such. This is considered to be the 80% of your effort should be on why of the subject as such. Then the rest of the things which are considered to be the 20% of the your skill set, that is are mainly related with the how and what of the subject as such. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. and what is the one video that you'd like to hear in the coming days in this particular channel. Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Don't forget, press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Something more in the next video. Thank you.